Hi everyone, my name is Bibi Hawa, and today I'm going to explain about stroke, or also known as cerebrovascular accident in medical term. For your information, stroke is Malaysia's third leading cause of death. So first of all, what is stroke? What is the definition of stroke? So stroke occurs when blood flow to the brain is blocked, and it also can occur when blood vessel in the brain burst. Therefore, when this happens, brain cells cannot obtain the oxygen and nutrients needed from the blood as there is no blood supply to the brain. Therefore, it leads to the damage of the brain tissue and the brain will start to die within minutes. So there are two types of stroke. First is ischemic stroke and second is hemorrhagic stroke. So what are the causes of ischemic and hemorrhagic stroke? First, the cause of ischemic stroke is due to the narrowed or blocked blood vessels in the brain that leads to severely reduced blood flow to the brain. Next, hemorrhagic stroke occurs when blood vessels in the brain leak or rupture. So here I inserted two pictures that describes ischemic and hemorrhagic stroke. The first picture here is on ischemic stroke. So we can see here the blood clot lodges in cerebral artery. So this will block the blood supply to the brain. And here we can compare two types of carotid artery. But this is the diseased carotid artery, and this one is normal carotid artery. So the diseased carotid artery, we can see here the artery is narrowed. You can see that the blood vessels is narrowed and it has plaque on it, which is the cause of the narrowed blood vessel. And so there will be poor blood flow here. Next is the normal carotid artery. So the normal carotid artery has a normal blood supply as there is no plaque to narrow down the blood vessel. Next picture describes the hemorrhagic stroke. So for hemorrhagic stroke, the first picture here is the burst aneurysm, which caused the subarachnoid hemorrhage. So subarachnoid hemorrhage is blood filled up in the space between the brain and also the surrounding membrane. And the picture down here describes the torn artery, which caused intracerebral hemorrhage. So intracerebral hemorrhage is bleeding inside the brain tissues. So these are the causes of stroke. Next is precaution of stroke. So precaution of stroke need to be taken in order to avoid having stroke in the future, or also if you had stroke in the past, to avoid a second attack of stroke in the future. So first precaution that can be taken here is that you have to monitor blood pressure regularly. So have your blood pressure checked at least annually, and we have to limit alcohol intake, have to include exercise in your daily routine, and you have to avoid smoking. And if you're a smoker, you have to have a plan to quit on smoking, and please do follow the plan. And next is reduce intake of foods that is high in cholesterol and saturated fats, such as fast food or oily foods. We have to reduce the intake of those foods. And finally, consume diet that is rich in fruits and vegetables. So next is how to spot a stroke. So this is very important because when the symptoms of stroke has been detected early and seek help early, it can reduce the complications or disabilities a person can have after the stroke. So here are the abbreviation for the sign and symptoms of stroke. So first is B. B stands for balance. So if you feel loss of balance or headache or dizziness, it may be one of the symptoms for stroke. And next is E. E stands for eyes. If you have stroke, you will have a blurred vision. Next, F. F stands for face. So you can feel that one side of the face is drooping. And A stands for arms. So you can feel weakness in your arms or leg. Next is S, stands for speech. You will have difficulty in speaking. And finally, T stands for time. So if you spot any of these symptoms in yourself or also people around us, it is the time to call for ambulance immediately to seek help at the hospital. Next is health education for patients who had stroke. So One of the health education that patients should know is some rehabilitation exercises. So it is very important for the patients to be aware of those exercises because it can help the patient to recover slowly and go back to the lifestyle that they had before stroke, as stroke can change your lifestyle by giving you some disabilities. So first rehabilitation exercise that can be done is physical therapy. So physical therapy is exercises to help you to relearn movement and coordination skills that you may have lost due to stroke. So some examples of physical therapy is walking, sitting, standing, and also lying down. So physical therapies can help you by doing all these exercises. Next is speech therapy. Speech therapy helps people who have problems producing or understanding speech. Some exercise that can be done here is breathing exercise, tongue strengthening exercise, sentence practice, practicing speech sounds, and also naming pictures. And finally, the third one is occupational therapy. Occupational therapy is to improve daily activities. So after a stroke, we will have difficulty in doing our daily activities that which was easy for us to do before we had stroke. So by doing occupational therapy, it can help us to improve our daily activities. Examples of occupational therapy is getting up from bed, toileting, self-grooming, getting dressed, and also feeding yourself. And here are the reference that I had. So that's all from me. Thank you.